The future of our people is threatened by diabetes, but we can fight it by controlling our blood sugar.
I choose healthy foods.
I exercise every day and keep my blood sugar close to normal.
I always take my medication.
Control your diabetes because our young ones look up to you. We must take charge for a future generation.
Control your diabetes for life. Visit yourdiabetesinfo.org.
My family history with diabetes started with my mother. She was diagnosed back in 1980. I was aware of it more in the 90s, and just learning the hardship of what she's gone through, I wanted to prevent it for myself and family. Being my mom's caregiver was an eye-opener. Just coming in and taking care of her, talking with her, taking her back and forth to the doctor's appointments, making sure she took her medication on time, eating right. That was a personal wake-up call for me to want to take better care of myself. I realized that I needed to lose weight after going to my physician, speaking with my doctor and him letting me know that my weight was high, and I was also experiencing high blood pressure. In the beginning, me trying to take the approach of losing weight, it was not easy. I did fall. I did struggle. My first step was just to get up, get out, and walk. Those were one of my first things. I knew that I would eventually have to take the approach on food, but my first thing was getting active and just getting motivated to get out. Physically and mentally, I did notice a change. I noticed a change just for the simple fact of getting out and moving. I started to drop weight. As far as physical activity, the things that I do now that I did not used to do, I went and bought an exercise ball. I get out to bike ride more. When I'm coming home, if we have a little bit extra time, I try to get out and play football with my husband and my children. And when I'm in the area, maybe taking a walk with my mom. My eating habits and portion control has been a great impact in maintaining my weight loss. We try to eat out of smaller plates. Then also just staying motivated with moving, having fun, and exercising. Some of the things that I do to reward myself, I don't keep myself from everything. One of my favorite things to do to reward myself is I still keep in portion control, but when we go out to eat, I like to have sushi. I stay focused to stay on track and meet my goals being a busy mom, just by the simple fact of educating my girls and my husband. The more educated they became, it made it a whole lot easier for me to maintain the good health. I feel wonderful now. Before in the past, my mood was down. I had a lot of weight that I was carrying, and that was just extremely a horrible feeling. But now I feel more motivated. I feel good about myself to even not just stay at this weight, but to continuously lose weight. My advice to a person that's trying to prevent diabetes would be to first get with your doctor, find out what your numbers are, where your numbers should be. Reach out and get support from those maybe in your church, your family. Just get highly educated about diabetes. And if you fall, don't stay down. Get back up again. To find more tools on preventing type 2 diabetes and managing your weight, visit yourdiabetesinfo.org. I'm Letitia Turner. I'm preventing diabetes by losing weight and keeping it off. It's not easy, but it's worth it.
For people living with diabetes and for those trying to prevent type 2 diabetes,
Healthy eating is important for controlling blood sugar, blood pressure, and cholesterol. It's also really critical for losing and maintaining a healthy weight. When you have diabetes, your family members can eat the same food that you're eating and benefit from it because they are at higher risk for developing type 2 diabetes themselves. Maintaining a healthy weight for a person living with diabetes is critical to manage blood sugar, blood pressure, cholesterol, and to prevent complications such as heart disease and stroke. A target blood sugar range for a person living with diabetes would be 70 to 130 before meals and 180 2 hours after a meal. But the best thing is to check with your healthcare team about a target range that's good for you. For a person who's trying to control their blood sugars, carbohydrates that they eat have the biggest impact on the blood sugar. So knowing how many carbs you're eating helps you keep your blood sugar in a good range. And carbohydrates are found in fruits, vegetables, grains, dairy products, more places than you expect. A dietitian can really help you count carbohydrates and find the foods that contain them. Since so many foods contain carbohydrates and you're trying to get the number down to a level that helps your blood sugar, a dietitian will help you balance all of that. Eating a healthier diet actually makes you feel much better, in addition to having better blood sugars. For a person living with diabetes or trying to prevent diabetes and maintain a healthy weight, these foods can really help. Lean sources of protein like chicken or fish, whole grain foods, crackers, cereal, vegetables, especially those that grow above the ground and the kind you put in salads, eating whole fruits in place of drinking juices, and using low-fat and non-fat dairy products like milk and yogurt. If making big changes in the way you eat seems overwhelming, think about small steps and try to find a quick win. One thing you can do to help you control your portions is you eat using a 9-inch plate. If you divide that plate in half and fill it with vegetables and fruits, that leaves you room on the other half for a quarter of the plate to be meat, probably about the size of a deck of cards or 3 ounces, and a quarter of the plate to be starch, grains or potatoes or bread. Try to eat your meals and snacks at the same time each day, and that way you won't get too hungry at any one time, which could lead to overeating. Take time when you're eating. Chew your food slowly and enjoy it. Give your brain a chance to know that your stomach is full. When it comes to seasoning your food, use herbs and spices. Leave the salt and butter on the side. Make a list when you go shopping and stick with it. Don't go shopping when you're hungry because that can lead you to some poor choices. Bring your lunch to work instead of eating out. This will help you control your portions and avoid overeating like you would in a restaurant. When you're cooking at home, wrap up and put away your leftovers promptly. This way you won't be tempted to go back for seconds. And think about stir fries. They're a great way for you to boost your vegetables and cut back on meat. Plus, they actually make very good leftovers. People fall off track all the time when they try and eat a healthier diet. It's normal. Don't get upset about it. Just try to get back on track soon after you fall off so you don't get totally derailed. It's normal to get discouraged periodically. Think about talking to a dietitian. They can help you tailor these diet recommendations to fit your needs and come up with a plan that's easier for you to follow. For a person living with diabetes, there are no special foods you need to buy. There are no foods you need to avoid entirely. With portion control and meal planning, even with diabetes, you can really enjoy eating. For more information about diabetes and healthy eating, visit yourdiabetesinfo.org. I'm Robin Edelman, and you can eat healthy with diabetes.
My name is Sorcy Apostol. I live in Elk Grove, California. I was diagnosed with type 2 diabetes in 1986. I was first diagnosed with diabetes when I was pregnant with my second daughter, and the doctor told me that it was gestational diabetes. I thought it was only during pregnancy. I was unaware that if I had gestational diabetes, the potential to develop type 2 diabetes is a lifetime risk for me. So I didn't do anything. As soon as I found out that I have type 2 diabetes, I had to call for a family meeting. We had to discuss it seriously because the doctor told me that both my daughters have a lifetime risk of developing type 2 diabetes themselves. I was motivated to make lifestyle changes because I was already feeling and experiencing the complications of diabetes. To help lower my family's risk of developing type 2 diabetes, we have done several things. We do exercises together. We walk around the neighborhoods. I use the treadmill regularly. I play a lot of games. And I do a lot of gardening. After being diagnosed with type 2 diabetes, I had to do a lot of changes with how I eat. I read labels now. I make sure that I eat either in a 9-inch plate or a bowl. And then I reduce my sweets, and I also tremendously reduce my carbohydrates intake. If you were recently diagnosed with a type 2 diabetes, the first thing that you do is educate yourself. And to get educated, go to yourdiabetesinfo.org. There, you will find a variety of resources that will help you control and manage your diabetes. I'm Sorcy Apostol, and I'm managing my type 2 diabetes.
The reason it's so important for a person to prepare for the encounter with the healthcare team is because this is going to be where the person gets the information that they need to help solve the problems that they may have been having in the management of their diabetes. Because you need to know what to do for yourself as an expectation between this visit and the next one you make. The kinds of things that a patient ought to be sure to bring with them when they come for a visit. One is to make sure that they have carefully outlined any recent problems that they've had, things that they're concerned about, so that those will get attention during that visit. They must get clarification about what things they need to do better and how could they do those things better to improve that aspect of management. They should bring the results of their glucose monitorings over a period of time, their logbooks or their meters that need to be downloaded. They should have a list of all of their medications, what they are, how often they're taking them, including non-prescription medications. Sharing information between the patient and the healthcare team is really critical because the patient really has to feel that they trust the healthcare team, that they can be open, they can be honest about anything that they have concerns about. I encourage patients to write down their questions, to take those with them to the visit, make sure that all of the issues get vetted, and then to write down the responses. You don't need permission to ask questions about your health. You don't need permission to write notes on responses that are given to you about your health. You are really ultimately the person in charge of managing your diabetes. You're getting advice from a team that you have engaged to help you with that. And you have to make sure that that team functions in a way that's going to maximally benefit you and the outcomes that you deserve. You can get more information about managing and preventing diabetes by visiting yourdiabetesinfo.org. I'm Dr. Gavin, and your healthcare team can help you manage your diabetes.
Hello, my name is Hattie Kaufman, and I'd like to talk to you about some very big changes in our nation's healthcare system and what it means for us as American Indian and Alaska Native people. The Affordable Care Act, which became law in 2010, opened the door to health insurance coverage by expanding Medicaid and providing free or low-cost insurance options for millions of Americans, including you and your family. Under the Affordable Care Act, American Indians and Alaska Natives can get free or low-cost health insurance. This insurance can be used at your tribal, urban Indian, or Indian Health Service clinic or hospital. You can also get services from a provider on your Marketplace plan. What's new is that when you enroll in a health insurance plan through the Health Insurance Marketplace, you can still get services from the Indian Health Service, tribal health programs, or urban Indian health programs. Plus, your insurance will pay additional services your clinic can't provide or are not offered by your local clinic, but you need for good health. Open enrollment is on an annual basis. However, tribal members and Alaska Native shareholders can enroll throughout the year and change plans once a month. And remember, American Indians and Alaska Natives can enroll in Medicaid or CHIP at any time. You can apply online. There are trained staff and online instructions to help you with the application process. If you need help filling out the application, there are special assisters to help you, so just ask at your local clinic. With health insurance coverage comes peace of mind. Knowing you have health insurance coverage will reassure you whatever arises. Necessary surgery, hospitalization, or referral to a specialist, you are covered. This is a big change. No more waiting on a medical priority list to cover special care. You will be covered. If you're an American Indian or Alaska Native eligible to receive medical care through IHS, tribal clinics, or urban Indian health organizations, you can have certain benefits and protections, including no deductibles or copayments, if you continue to use your IHS, tribal, or urban Indian health program. No premiums, enrollment fees if you are eligible to use an Indian health or urban Indian program. And no deductibles or copays for Medicaid. No out-of-pocket expenses if you are enrolled in the Children's Health Insurance Program, CHIP. You will not be assessed a tax penalty by the IRS if you do not have health insurance. You do have to apply for the tax penalty exemption. Tribal members, Alaska Native shareholders, and individuals eligible to receive services from an Indian healthcare provider can all apply on their federal tax returns or through the Marketplace application. Remember, even if you apply for an exemption, you can still get coverage through the Marketplace, Medicaid, or CHIP, and receive services from an Indian healthcare provider. Plus, if you're an enrolled member of a federally recognized tribe, you have benefits in addition to the ones I just mentioned, including no deductibles or copayments if your household income is below certain limits, around $70,000 for a family of 4 in the lower 48 states, or around $88,000 for a family of 4 in Alaska. And you and your family can enroll during any month of the year instead of waiting for an annual enrollment period. In addition to the special provisions offered to American Indians and Alaska Natives, our people are also covered by the basic benefits of the Affordable Care Act that apply to all U.S. citizens. This means you can't be denied coverage because of a pre-existing condition. There's no lifetime limit on how much care is paid for if you get sick. Your coverage can't be canceled if you get a serious illness. And preventive health care is covered, like mammograms, flu and pneumonia shots, and well child visits from birth to age 21. The Affordable Care Act honors our unique trust relationship with the federal government as Indian tribes and Indian people. Special provisions continue so that certain payment from Indian land or treaty rights and money from the sales of items of cultural or traditional significance won't be counted for determining Medicaid or CHIP eligibility. So, how do you apply? You can fill out an application on healthcare.gov or by telephone, or you can ask your local clinic or hospital to help you fill out a paper application. Your information will remain confidential. There is a special section on the application just for American Indians and Alaska Natives. To take advantage of the special benefits and protections, you must fill out the full form and the section for American Indians and Alaska Natives. Whether you're an enrolled member of a federally recognized tribe or a non-enrolled descendant of a tribe eligible for IHS, tribal, or urban Indian health care, you may qualify for these special benefits and protections, but you must apply. On the application, you'll be asked about Social Security numbers for you and others applying for coverage, employment or income records, information about current health insurance, including information about employer health coverage, if you are enrolled in a federally recognized tribe, If you have ever received health services at an IHS, tribal, or urban Indian health clinic, and how much income you receive. The most important thing to remember when filling out the application is that you only report Indian income that you would report on your federal income tax returns. When you enroll in this new free or low-cost health coverage, you'll have the peace of mind knowing you are covered. Also, your IHS, tribal, or urban Indian health program will be able to bill your insurance, bringing in much-needed resources for our community's health programs. When you need to see a specialist, you will be referred to one, and you will not have to wait to see if there are contract health services or CHS dollars available, or be placed on a CHS waiting list. In the future, you may hear the phrase purchased or referred care, or PRC instead of CHS. Our American Indian and Alaska Native communities have done a lot with very little for a long time. We've worked hard to protect the federal trust responsibility to provide health care to our people. Now many more of our young, old, married, single, employed, unemployed, those with children and those without children have health insurance options. Our people, including you, deserve the best coverage available. So protect yourself, protect your family, protect your people. Ask about applying to the Health Insurance Marketplace or Medicaid and CHIP today. To learn more about the health insurance options available under the Affordable Care Act, Medicaid, and CHIP, go to www.healthcare.gov or ask your clinic provider or business office for an application. If you will need assistance filling out the application, please contact CMS at 1-800-318-2596 to get the additional assistance needed. If you are a TTY user, please call 1-855-889-4325. We want to make sure no one misses out on gaining access to this insurance opportunity.